Hey, what's going on, guys? Today we have Dr. Arman on. He is a general dentist who focuses on implants and cosmetics. Thank you, Dr. Arman, for joining us today.
Yeah, my pleasure, guys. Thank you for having me.
So, for our first question, we want to know the difference between work as an implant dentist, doing implant procedures, and cosmetic procedures.
In dentistry, we have specialties, right? So we have pediatric dentistry, we have implant dentist, we have periodontics, which is basically implants and gum surgery and bone surgery. We have oral surgeons that also do implants and that extract teeth and do, major surgeries like that. We have orthodontists who do braces. That's their specialty. We have prosthodontists who do full mouth reconstructions and, fixing people's bites and complicated procedures like that. You have even dental radiologists who will just look at x-rays and CBCTs, cone beam images, which are 3D scans of the jaw, and find pathologies. So there's a lot of subspecialties in dentistry. Implant dentistry and cosmetic dentistry are not subspecialties per se, but if you have the appropriate training and you've gone through the steps, then anyone can do these procedures. So for me, I focus on doing implants. I like to do cosmetics. I like to do full mouth reconstructions, which is all basically under the umbrella of fixed prosthodontics or removable prosthodontics. And that that just happened by chance because I started to focus on that when I was in dental school. In my senior year of dental school, I was part of an honors aesthetics program. So the inventor of the porcelain veneer, Dr. John Calamia, was our mentor in that program. He was the director of the program. So to have somebody like that who really understand, he made the porcelain veneer. Everyone that you see on Instagram that has these beautiful, bright white teeth, they really owe it to that guy, because that guy was the one who started it, and he's the one who really propelled it into dentistry. And then Larry Rosenthal, who is a very famous cosmetic dentist in Manhattan, he really brought it to the forefront, and he made a lot of dentists. He trained a lot of dentists on how to do that kind of stuff. So, for me, I found that focus on the cosmetics early in my senior year of dental school, and I decided to pursue it. And I took all the continuing education that I could find and get my hands on right out of dental school, in order to learn how to do those procedures. And as far as implants, that I started to get into maybe 4 years ago, like halfway, through. I did my residency, and then I did a couple of years I was practicing, and I was like, you know what, I really like implant dentistry. I want to be able to give my patients this, the ability to chew, to restore their bite. And so, I dived into implant dentistry, and I took a continuum on how to place implants at NYU. And then I took a course, another course on how to do implants and placing them surgically. And, that's kind of how it goes in dentistry. You find what you really like, and you hone in on it, and, you take it from there and take as much education as you can and learn from it. It never stops, so everyone that's out there right now wanting to get into dental school and wanting to, pursue that career path, just know that it's a continuous journey of learning, and we're all about that. So I love it.
So what different skills did you have to learn in order to participate in these specialties, like cosmetic dentistry, implant dentistry, and reconstruction?
So, what you do is you take these courses, and when you're taking these courses, what skills do you hone? Like, what are the skills that you develop? Is that what the question?
Yeah, that's yeah.
So, it's all just hand-eye coordination. I mean, implant dentistry, has gotten a lot easier now because we have 3D scans. So a cone beam is, that machine that goes 360 degrees down around the patient's head. That's a 3D scanner, and it scans your jawbone so that instead of a regular X-ray, which is just a two-dimensional image, which you only see height, right? Mm-hmm. You can see height, you can see width, and you can see all three dimensions of the space that you want to put the implant into. And the other cool thing now is that we've developed, over time, dentistry has developed into 3D printing. And now we can 3D print a jaw, like the jawbone of the patient, along with that 3D scan, and we can plan a surgical implant before you even go in and open the tissue and place the implant on the patient. You can do it all guided, which is making it a lot easier and a lot less traumatic for patients to have to get those procedures done. So, it has to do with the tech developing over time. And it has to do with taking these courses, and most of dentistry, no matter what you do, is basically just hand-eye coordination and training your hands to be able to do, these preparations in certain ways and to place the implant in the correct angulation, right? So I think that answers your question.
Yeah.
Yeah, no, that was very helpful.
How many, what percentage of practices would you say have this type of technology, like the 3D printing and stuff like that?
So the 3D printing is relatively new. I wouldn't be able to tell you exactly, but I would say probably less than 10% of practices have 3D printing in them. More than that have the 3D scanner, the cone beam machine. I would venture to guess, because that's been around for a little bit longer. And as we go on, as you guys go into dentistry, and I know, Mark, you were saying you wanted to pursue dentistry. By the time you're out, I think everyone's going to have it in their office. I don't think that there's going to be many dental offices without this kind of technology. It just makes sense. It's just easier. It's easier for the practitioner. It reduces error because we're human. We have human error in anything we do. So if you can reduce that, why wouldn't you get the tech? And tech gets cheaper as time goes on. So if it gets cheaper, it's more affordable for more dental practices to get it. And right now, only the top dental practices have it, but over time, that's going to change as the technology develops and, the cost goes down and everyone can start to afford it and bring it into their practices.
Mm-hmm. Could you describe daily life as a dentist? Like how your day-to-day life is?
Sure. For me, so I'll give you a little background on me. I did my residency out of dental school. I did a 1-year residency, a GPR, and then I found some jobs. And as a new dentist, usually in New York, you don't get one job, you find a couple of jobs, right? Because not a lot of offices have the capacity to have you full time. So, I got 2 or 3 jobs when I first got out. And then slowly I started to wind down into one position. Then I had that one position for a little while. And as time went on, I found a better position and I took that position. So right now I'm in a practice in Manhattan that focuses on the cosmetics and the implants and the full mouth reconstructions. And I'm very happy there. And what we do day to day is, we get into the office, we have a huddle with the team, we figure out what's going on in the day. As a dentist, you not only have to manage your column of dental patients, but you also have the hygienist, and you have to go into the hygiene room. The hygienist is seeing a patient every hour. So every, half hour, 45 minutes, you have to jump into the hygiene room and do a checkup on a patient and make sure, you do a thorough checkup, see what they need, see if they're, doing oral cancer screening, check the tissues, check the gums, check the teeth themselves, of course. And that takes time. So you have to manage that. And the way we manage that is we do this huddle in the morning. And the huddle kind of is basically like if you play any kind of, team sports, you have that huddle in the beginning of the game. And on timeouts, you have a huddle too, right? You figure out what's going on. Where can we pivot? Where can we, if this patient needs treatment in hygiene, where can we get them into today's schedule so we can take care of them today so they don't have to take another day off work or take another hour off work and come in and get treated. So the huddle is a big part of it. And then day to day, we do all types of dentistry. We will do fillings. We'll have, some root canals here and there. We'll do the implants as we do them. Just today we scanned somebody. So we're planning a case today to do some cosmetic work on a gentleman who's just turning 70 actually. And, he's been in the practice for 30 years. This doctor that we work with has had him in the practice for 30 years. And, he's always talked about doing some kind of cosmetic work, and the patient was just never ready. And so now he's ready. Go figure what happened today, but he's ready to do it. And today we took the scans on him. We took 3-dimensional scans of his jaw, and instead of taking the molds that you would typically take with the goop, you know what I'm talking about?
Mm-hmm.
Maybe
Yeah.
the goop in the thing, and they put it in the mouth, and the guy's like, I can't breathe, and he's choking down, and half the stuff goes down his throat, half the stuff is in his mustache. That stuff, we got rid of that stuff. So now we just scan them digitally, and we're able to send that to the laboratory to plan our case. So day to day, it's just a lot of chaos, and it's managing chaos, and it's fun. I gotta say, I love it.
What are your favorite types of procedures and why?
So yeah, I mean, my favorite stuff to do is that kind of, the stuff that's going to have the most impact, that the patients are really going to feel like, wow, something's got done, and to me, that's the cosmetic work. When they come in and the guys lived 70 years with these yellow teeth that are broken down, worn down. This tooth, this is a different color, this is a different color, and his bites collapsed, and all of a sudden you're going to change that, and you're going to put him in the proper bite position, and you're going to get his jaw comfortable, right? And that's going to change his whole life, because this guy's 70 years old. He's still with it, but as they get older, and this is what I've seen from a lot of my patients, because a lot of my patients are like in their 50s and 60s, and when they get this cosmetic work done, and it's not just cosmetics, it's also function, and that's the thing we focus on, is functionally driven cosmetic work. So these guys are in their point in their lives where they've really done some damage. Think about what you do with your teeth. You're constantly, you eat 3 meals a day for 70 years. You're talking, you're chewing on ice, you're opening things with your teeth sometimes. Some people are doing that. So there's a lot of activity going on there. You're grinding in your sleep. So over time, that does a lot of damage to the teeth. It worns them down a lot. And when you can restore the teeth into the proper position that they were in, maybe when they were in their 40s or 30s, and you can get them that bright white smile, the natural look, whatever they're going for, then their confidence goes up, and they feel better about themselves, and they just have this different attitude. Like when I did my mother's teeth a couple of years ago, and she was just a completely different person. She was more confident. She used to never smile in photos. Now she was smiling all the time. She was happy in her bite. She was always having some TMJ issues, some, joint issues. And she was completely good. And, that's how she's been living for that, 60 years or so. And now she's happy and she's fine. And that's going to continue on. And when they get to their 80s and 90s, now they don't have to worry about doing dentures, right? I don't know if you've had any grandparents or anybody like that, that has had dentures, the things that come in and out of your mouths, but those things are terrible. Like they can't eat anything normally. They have to eat soft foods. They chew on something, it falls out of their mouth, or they're smiling, all of a sudden it falls out at the wrong time. They're in a wedding and taking a wedding photo, and then bop, it just comes out of their mouth. That's a horror. So, and that really affects patients psychologically. It doesn't matter how old they are, no one likes that kind of stuff. So those are the cases that I enjoy the most, that truly have like this lasting effect on people, and they're very appreciative of it. And it's very rewarding as a dentist to be able to provide something like that.
Would you open up your own practice as a dentist, or do you like where you're at right now?
So look, everyone's different, right? I've been in maybe 8, 9 offices. The office that I'm at right now, I love. I couldn't get enough more of it. I work closely with my mentor. So that's one thing that's really big for me. And he's a big name in dentistry, and he goes around the world and lectures. So to have him there and to learn from him day to day is invaluable. And if I had my own office, I wouldn't be able to do that. So for right now, I'm very happy where I am. But everybody's different. They gotta see. If I was in my other offices that I had worked in previously, would I still want to be there? Maybe not. Maybe then I'll be thinking, okay, I should open my own office. I want to have my autonomy. I want to do whatever I want to do on my time. But in the office that I'm at now, I feel like I have that, and I have the mentorship, and I have everything that I want. So, And, it's top 5 practices in Manhattan. So what am I going to do? Where am I going to go to make it better for me? So right now I love it. But again, that's a question that everyone needs to kind of, figure out for themselves. That's what's great about dentistry. You don't have to do any one which way. You can work for a DSO and be very happy. A dental service organization, which is basically, corporate dentistry. You can work for that. You can work for a private office. You can open up your own office. You can work for a Medicaid office. There's a lot of different things you can do. And I have friends that do it in all these different spaces. And, you can ask them how they feel in that moment. Sometimes they're happy, sometimes they're not. But like it's up to the person to choose what they want to do.
Hmm. And can you tell us a little bit about the differences between corporate dentistry and opening up your own practice?
So I'll tell you a little bit about corporate dentistry versus private practice dentistry, because you can open up your own office and be a corporate office, right? You can go tomorrow and say, Ron, Mark, you want to go open up Ron and Mark's dental offices. And now you're everywhere from Stony Brook to Queens and you have 5, 10 offices. You can do that. If you're a general dentist, you can go out, or you're any kind of dentist, really, you can go out and do that. If you have the finances and you have, the will and the desire to do it. So corporate dentistry and private practice, the major differences there is that, when you're working in a corporate office, you don't have to manage the day-to-day businesses of dentistry, right? It's kind of like what happened in pharmacy. So in pharmacy, there used to be individual mom and pop pharmacy shops. Now all you see is CVS, Walgreens, Dwayne Reed, whatever you have, right? Walmart. And those people that used to be the pharmacist and also run the office are no longer doing that. They're just doing the pharmacy stuff. Same thing in corporate dentistry. They're just doing the dental procedures and the day-to-day of hiring somebody or even firing somebody, right? Dealing with overhead and all that kind of headaches that some dentists don't really want to deal with. Corporate dentistry relieves you of that. But with that being said, in corporate dentistry, you also have somebody that's over you that's going to tell you, sometimes that this is what we need from you, and you're not your own boss, and you don't have so much autonomy in certain situations. So it's, and every corporate office is different, right? Like there are some that I've heard horror stories from, and there are some that I've heard very good things from. So, but the major difference is you don't really, you're not involved in the day-to-day business of dentistry. You're just the dentist making the dental calls, and that's about it.
Would you say that corporate dentistry has harmed some aspects of opening up your own practice or like private practices?
Absolutely not, man. I don't think so at all. I think, if you want to go out there and you want to open up your own dental office, you are in a very good position to do so. You just have to be, you have to do the right thing by the patient. That's the number one thing, right? If you treat your patients right, they're always going to refer people to you and they're always going to come back. Okay. So yeah, some people are going to leave, you don't take their insurance or whatever, but that's not like the common person that's going to be in your office. The people that you want in your office are the ones that truly value what you do for them. And if you truly value them, you do the right thing for them. And then they stay and then they refer their friends and they see that. So I think corporate dentistry is definitely taken a big chunk of what we see in dentistry now. And it's going to continue to do so. I think that trend is here to stay and it's going to go up. Right now, I don't know what the percentage of corporate versus private offices is, but it's heavily more private than it is corporate. But that dynamic is going to change over the next 10, 15 years. And you're going to see more corporate over private offices. But that doesn't mean that you can't go open your own private office.
So how do you usually find a job after residency?
So, it might be a little different now, but and this is crazy because it wasn't that long ago, but when I was looking on Craigslist. And Craigslist was a big thing. Indeed was kind of a big thing too. The first job that I found though was through a friend of mine, and my friend graduated hygiene school the same time I graduated dental school, and I had known her since elementary. So she already had an office lined up for herself, and the dentist there needed a associate dentist as well. So, I just met with the general dentist that was there that owned the office, and we hit it off, and she hired me right out of residency. And the other jobs that I found were actually through Craigslist during that time. So right now, I think it's pretty much the same thing. You can look at Indeed, you can look on Craigslist. But the best thing to do is really like, if you guys are in your age range, you guys are where you're at, right? Like everyone that's listening to this right now, if you're interested in dentistry, you got to go get it. Like you got to go after it. Call some offices. It might be a little hard because it's COVID now, but like call some offices, and see if you can go in and shadow. And if you can go in and assist, and just for a day or 2 days or one day a week, whatever it may be, but get your foot in the door and find offices that you know are reputable and that have good reputations and that will let you come in and help out or just see what's going on. And we do that often in our office. We have people shadowing in our office all the time, whether they be interested in dentistry, like if they're undergraduate students or if they're already dental students. And we have a lot of dentists that come in and shadow in our office too. So, just go out there. If you're really interested in it, you need to like really be immersed in it and see if this is for you, because it's a big commitment, right? You're not only going to do your 4 years of undergrad, you're about to do 4 years of dental school. Not to mention you have to study for that DAT, which is another thing that you have to do, right? So that DAT is a big thing, a big chunk that you have to take out. So you're going to commit a lot of your life to this. You need to know if it's for you first. And the only way you're going to know that is if you start getting into dental offices and seeing how they're run and seeing if you really enjoy it.
When working at an office, how can you like move up in positions? Like you were saying, like at your office, you have a lot of like a good amount of autonomy, but was it like that as soon as you got in or over time, and that's how it became?
So I'll tell you how I got into my office. And the reason I tell you guys you should go shadow is because the reason I got the position in my office, which again is now, you go look up our office, New York Smile Institute. It's one of the top 5 dental offices in Manhattan, huge reputation. And I actually ended up emailing the owner of the office, and I was already out. I think at this point it was 4 years I was out of dental school. And I emailed the guy and I said, and it was Dr. Dean. I said, Dr. Dean, can I come shadow you, next week? Would that be okay? And he said, yeah, come by, just, bring a white coat and come shadow me. And I came in and I shadowed him for the day. And, again, I had 4 years of experience already. I was a practicing dentist. I had a day off and I wanted to learn some more. So I went in, asked all the right questions. And at the end of the day, I said, can I come back next week? And then I came back next week. And then I asked again, can I come back next week? And I was asking more questions. And I was really like enthusiastic about what was going on. And I really wanted to learn. And he saw that. And then, slowly he started giving me responsibilities, like get this person. And then he was looking, I didn't know he was looking, but he was watching to see if this patient was in pain when I was giving them the injection or not, right? Like something so basic like that. And then he would give me, make these temporaries or take this impression. And then he was watching all the way through. And after a couple of months of just being in there once a week, just volunteering, he offered me a job. So that's why I tell you, you got to be in it. Like if you're really interested in doing this stuff, you got to go get it, man. Like no one's going to give it to you, especially now. No one's going to give it to you. There's so many people out there, and it's easier now. You can see like the dentists, there's Instagram and there's Facebook and there's a lot of marketing going on. So you see what's going on out there, right? You see like who's doing what, and you kind of see, like what dental office is kind of busy, and you can just message them and be like, hey, can I come in? Can I see what's going on? And be respectful, go in, ask questions, be enthusiastic, want to help, because everyone's looking for that help right now too. During COVID, a lot of assistants, now it's very hard to find assistants in a lot of offices. So, this is a great time for someone that's an undergrad that's working, like studying from home, that if they can get into a dental office and say, listen, I want to assist and I want to learn, right? And that way you get, some experience under your belt too, and you see if it's the right thing for you. And you can write that on your resume, and you're helping out this practice. And think about maybe down the line, that practice might need a dentist, right? And 4 or 5 years later, that might be you. So, because you were the first one interested, you were the one that put it first foot forward. So,
can you
this is
tell
a
us about
way to think about it.
can you tell us about some of the new technologies that you're using as a dentist?
Yeah. So, what we got in the office is pretty cool. We just got a new cone beam machine about a year ago, which is a cone beam is a 3D, that 3D machine that I was telling you that goes around your head. So basically it will show you the dimensions that you can place implants. It can show you the joint, the TMJ joint, and where it's at. I think it says we have like 10 minutes here. So it can show you the joint. And all those things are invaluable when you're trying to plan implants or when you're trying to plan a full mouth reconstruction. So those things have made our lives a lot more easy and our dentistry a lot more predictable. The other thing we have is intraoral scanners. So instead of taking the goop and putting it in the molding, we scan the jaw, and now we have this digital impression that we can send to the lab right away. And there's no inaccuracies in it because it's a scan of the jaw. So with the goop, there's inaccuracies of if you took the goop the wrong way, or if they poured the stone in the goop the wrong way, right? So there's a lot of inaccuracies in that, which are eliminated now with digital impressions. So the digital impressions are a big thing. And we use, we've been using cameras for a long time, but we use DSLR cameras to document our cases and show patients and teach them what we got going on in their mouths. And that's just, some of the tech that we have.
We saw on your Instagram a picture of you and Danny Green. How is the office able to get clients like that?
Listen, man, that stuff is all, it's just, so Danny came from a patient of mine who's his manager, and it just came from treating his manager like a nice, regular person. I took care of her. I made sure she was comfortable every time she was in the office. I did some treatment on her. She enjoyed it. She liked what her result was, and she talked about it with her client, and her client came. And that's like what I was saying in the beginning of this, right? Like, it's all just about taking care of the patients. If you take care of the patients, everything else will come and fall into place. So you never know who's in your office and who might be, connected to who. And as long as you treat everybody equally and you treat them well, then things will come. And, that Danny's an example of that. So.
And what tips would you give to an aspiring dentist?
It's a long road. Okay. Don't feel like you have to sprint. This is just, it's a process, right? And I tell everybody that's looking to do it, like, dental school is just learning the alphabet. You're just learning the ABCs. In residency, maybe you learn to put sentences together, but throughout your, career, you're going to learn to put those paragraphs together and those documents together. You're going to learn how to write an essay throughout your career. So it's a long process. And dentists tend to be kind of harsh on themselves. They want everything to be perfect, and the mouth isn't a perfect place. Let's say you get a knee replacement, they tell you that your knee replacement is going to fail in 10 years, right? They give you a timeline on that. So why don't we give a timeline on implants, right? So we think we have to be perfect, but we really don't. And that stems from, right in undergrad. Like, when you're in undergrad, you're thinking you have to be perfect to get into dental school. So then when you're in dental school, you have to also be perfect, because if you want to specialize, they need the most perfect person, right? And then it goes on and on and on throughout your career. So the number one thing is just, do your work, spend the time, making sure this is the right thing for you, because you're going to be spending a lot of your time afterwards, when you choose to do this, practicing dentistry. And it can be stressful at times, but it's also very rewarding, and it's fun. If you really enjoy it, it's fun. That's why I urge you guys to really get out there and try to shadow and try to, learn from some practicing dentists and see if this is the right thing for you.
Thank you.
Yeah.
Okay. I think that's all the time we have for today. So we want to say thank you so much for joining us and giving us some great advice and information.
Ron, Mark, my pleasure, guys. Thank you for having me.
Awesome.